Picture this. You're setting up a sterile field for a bedside procedure, and one wrong move could contaminate everything. What's the critical mistake that forces you to start over? Stay tuned to ace this NCLEX style question. Let's dive into a case study about a nurse preparing a sterile field for an invasive procedure, like a central line insertion, using the ADPI framework to build your clinical reasoning. First, assess the environment and equipment. Check that all sterile items are unopened, undamaged, and within expiration dates. Ensure the bedside area is clean and free of clutter. Key point: the sterile field is only sterile if it's untouched by non-sterile items or surfaces. Watch for anything that could compromise asepsis, like reaching over the field or turning away. Diagnosis. Next, identify risks for contamination. The nurse must maintain a sterile zone from the chest to the sterile field level, with gown sleeves sterile from 2 inches above the elbow to the cuff. Turning the upper body away from the field breaks this zone, risking contamination. Other risks include placing items too close to the edge or using non-sterile techniques. Planning. Plan to maintain asepsis by keeping the sterile field in sight at all times. Introduce the novel term, asepsis, the absence of microorganisms to prevent infection. Plan to place sterile items at least 1 inch from the field's edge. Use sterile gloves and avoid reaching over the field. Patient teaching. Explain the procedure to reduce anxiety and ensure cooperation. Implementation. Set up the sterile field on a clean, dry surface. Open sterile packages away from the field and place items carefully, keeping them 1 inch from the edge. Don sterile gloves and, if needed, a sterile gown. Pour sterile liquids into containers on the field using a no-touch technique. Crucially, never turn your back or upper body away from the field. This breaks the sterile zone. Evaluation. Evaluate the field for breaches. Was the sterile zone maintained? Did any non-sterile items cross the field? If the nurse turned away, the field is contaminated, and you must start over. Recheck all steps to ensure asepsis before proceeding. You're setting up a sterile field for a bedside procedure, and one wrong move could contaminate everything. What's the critical mistake that forces you to start over? Correct answer: A. When the nurse turns his/her upper body away from the field. Rationale: turning away breaks the sterile zone from chest to field, violating asepsis. Items can be placed 1 inch from the edge, an impervious gown isn't always needed, and pouring sterile liquid into a container on the field is correct if done properly. Clinical application. Maintaining a sterile field prevents infections like CLABSI, central line-associated bloodstream infections. Nursing tip: always face the sterile field and keep movements deliberate to avoid contamination. Future nurses, love these NCLEX tips? Subscribe, hit the bell for daily drops, like, and share with your study group.